A study recently published by the BMJ has found a troubling link between antipsychotic use in people with dementia and a higher risk of severe adverse outcomes. These outcomes include stroke, blood clots, heart attack, heart failure, fractures, pneumonia, and acute kidney injury. The findings reveal a broader range of harms than previously acknowledged in regulatory alerts, with the highest risks occurring soon after starting the drugs. This underscores the need for increased caution during the early stages of treatment. Despite safety concerns, antipsychotics continue to be widely prescribed for behavioral and psychological symptoms of dementia. These symptoms include apathy, depression, aggression, anxiety, irritability, delirium, and psychosis. Previous regulatory warnings focused on increased risks for stroke and death, but evidence of other adverse outcomes remained inconclusive among people with dementia. To address this uncertainty, researchers investigated several potential adverse outcomes associated with antipsychotic use in this population. Using linked primary care, hospital, and mortality data in England, researchers identified 173,910 people diagnosed with dementia between January 1998 and May 2018. Each of the 35,339 patients prescribed an antipsychotic was matched with up to 15 randomly selected non-users. Patients with a history of the specific outcomes under investigation were excluded from the analysis. The most commonly prescribed antipsychotics were risperidone, quetiapine, haloperidol, and olanzapine, accounting for nearly 80% of all prescriptions. Compared to non-use, antipsychotic use was associated with increased risks for all outcomes, except ventricular arrhythmia. For example, in the first 3 months of treatment, pneumonia rates were 4.48% among antipsychotic users versus 1.49% for non-users. At 1 year, these rates rose to 10.41% for users versus 5.63% for non-users. The researchers estimated that over the first 6 months of treatment, there could be 1 additional case of pneumonia for every 9 patients treated. For heart attacks, there could be 1 additional case for every 167 patients treated. This observational study, based on reliable health data, cannot draw firm conclusions about cause and effect. However, it highlights a wider range of serious adverse outcomes than previously noted, particularly soon after treatment begins. The findings are directly relevant to guideline developers, regulators, clinicians, patients, and their carers. Any potential benefits of antipsychotic treatment must be weighed against the risk of serious harm, with treatment plans reviewed regularly. These results provide healthcare professionals with nuanced data to guide personalized treatment decisions. International guidelines advise restricting antipsychotic use to adults with severe behavioral symptoms of dementia, but the rate of prescribing has risen in recent years. This increase is partly due to the scarcity of effective non-drug alternatives and the substantial resources needed to implement them. Increased priority on more patient-centric care, tailored care plans, regular reassessment of management options, and a move away from the overprescription of antipsychotics is overdue, the researchers conclude.